Hi, everyone. Welcome. Good afternoon, everyone. Welcome to our South Carolina Medicaid Getting and Keeping Coverage training. I am Megan Branham. I am the Director of Community Health and Policy here at Family Connection, and my co-presenter today, I'll let her introduce herself, Aisha.
Good afternoon. I am Aisha Coney with Department of Health and Human Services.
Thanks so much. So today's presentation is a two-parter presentation. We are going to be going over a little bit about South Carolina Medicaid, and then talking a little bit more about the annual re-enrollments that are resuming with individuals who currently have Medicaid. So we have about an hour to spend together. It's a lot of content to cover in a very short period of time. So if you have questions, you can drop them in the chat at any point, or I'll give you a little bit more information about how to contact us afterwards if you have questions. But we'll do our best to get to as many questions as we can if you just want to put them in the chat as we go through. So real quickly, for those of you who are not familiar with Family Connections of South Carolina, we're really glad that you are joining us today. Our work is focused on supporting families who have a child with special health care needs or disability in the state of South Carolina. So we work with families with children of all ages. Our services are offered at no cost. We provide them in English and in Spanish. And parents typically contact us, or caregivers contact us, for help navigating the education system, navigating the healthcare system, or just looking for community resources. Like I said, it's a lot of content to cover today. So if at any point you have follow-up questions from our presentation, or you have questions just related about our services in general, you can contact us on our support and information line. That 1-800 number is listed on your screen. It's 1-800-578-8750, and you can contact our staff and ask any questions that you have, and we'll try to connect you with a member of our team that can best serve you. Okay, great. Let's see. So here's a quick overview of what we're going to cover today. We are going to talk about Medicaid, including Tephra. We're also going to talk a little bit, about Medicaid waivers. And like I mentioned, Aisha is going to cover the part about annual renewal process. And again, all this information is as current as of today because things do change from time to time. So what you're going to see today is the current listing for these Medicaid services and supports. So South Carolina Medicaid, the benefits are really sort of divided into really two categories you can think about. For those of you who are familiar with DHHS, our Department of Health and Human Services, that is our Medicaid entity for the state. And underneath our Medicaid entity, HHS, we have a couple different Medicaid coverage options, which we're going to get into a little bit, including you'll see Partners for Healthy Children, Age Blind and Disabled, Family Planning, and Tephra. Certainly not a complete list, but for purposes of today, those are usually the ones that individuals have the most questions about or more familiar with. SSI is a completely different category and entity. It is administered at the federal level. And so while those two do work together, SSI and Medicaid often do go hand in hand, they are not administered in the same way. And I have mentioned that because sometimes it can be kind of confusing understanding what happens at a state level versus what's administered at the federal level. And we'll talk a little bit about Tephra and SSI a little bit later, just some of the restrictions perhaps around utilizing those services. So again, This is a quick overview of just the categories of Medicaid eligibility. So Partners for Healthy Children, also known as PHC, because there's always acronyms in this type of work that we do. It's available for children up to age or youth up to age 19. One important thing to note is that there are income limits, and they have recently changed. And so they have actually increased. So the income is at or below 213% of the federal poverty limit. So that roughly comes out to about a family of 4 cannot exceed $5,325 per monthly income. Now, of course, those income limits are different depending on the size of the family, but you can average, that's about what a family of 4 is looking at, and that they cannot exceed that amount in order to qualify. All children will be covered and they will receive the full benefit plan. Age blind and disabled is another category. It's exclusively for individuals who are age 65 and older, or blind, or totally and permanently disabled. So for a lot of families, they find that once their child ages out of maybe Tephra or maybe one of the other Medicaid coverage options, they can then transition to age blind and disabled based on their income and their disability status. So income for this is a little bit different. It's at 100% federal poverty limit, and this does include resources for an individual or for a couple. And certainly Medicaid can take a look at what is or is not considered a resource to make sure that people will qualify within these parameters. Family planning and pregnant women and infants is also in 2 other categories. Family planning is available at any age and will include certain physical exams, preventative screenings. Family income is at 199% of the federal poverty limit. Again, family of 4, a little under $5,000 a month. Same for pregnant women and infants. That income limit is at the same level, 199%. And that will include coverage 12 months postpartum. That is a relatively new addition or change from last year, where it was 60 days coverage for women. It is now 12 months postpartum, and coverage for infant lasts the same period of time as well. So coverage for infant and mom are lasting that full year. So this is the HHS website where individuals can take a look and see what they might be eligible for. apply.scdhhs.gov. You can also visit on this website. You can also locate local offices, and depending on what county you're in, if you would like to apply or have questions in person. Certainly our team can assist you in determining where might be your closest HHS or Medicaid office to get additional information. But the Medicaid, the Healthy Connections website is a great starting point just to see what options are available and answer at least some initial questions you may have. I'm going to pause for just a second, see if there's any questions. Naomi, I did see your question about mode of care, so we will get to that. I can talk a little bit more. Thanks for asking. So Tephra is a Medicaid category that is also referred to as Katie Beckett, the woman who created and founded this work as a mom who was trying to support her daughter who has special health care needs and just services that were not covered already under the typical Medicaid benefits. So Tephra is very special in that it allows children who would not ordinarily be eligible for SSI because of the parent's income to receive those Medicaid services. So Tephra is really only going to look at the child's income and the child's resources. So it takes the parents or the caregivers out of the equation for eligibility and focuses on the child's income and then the child's diagnosis. So these are the eligibility categories for TEFRA. Again, they must be under the age of 19. They meet that definition of Social Security Administration, this definition of disability, which we'll talk about that a little bit. And that the child's income is, you'll see right around that $2,700 a month range. Again, for most families, they're applying when their child's young, so their income is not really a factor, but they can, certainly older children or older youth who work and have a part-time job or something like that can certainly be eligible for, and their income wouldn't count against them if they're under that range. Child's resources, again, at or below $2,000 for some families who might have, a special savings account or some additional other funding set aside for their child, will often find that they need to make sure that that amount falls within that 2,000, or move it to something like an ABLE savings account that's not going to count against them. And we help families work through that all the time, just to make sure that they have everything set up in the process of applying, and that they're not going to get kicked out of eligibility because of that. And again, that the child must meet that institutional level of care. Not that that child needs to be institutionalized, but that their abilities or their needs are so serious enough that it would require some type of that level of care. I'm going to pause. Okay, great. I see some questions about TEFRA, so I'm going to get back to those in just a second. Again, TEFRA is really a cost savings plan. It is really something where the child is going to receive the full benefit of their plan, and again, that they're going to be able to receive those services in home and community, not in a hospital type setting. So if you have questions about TEFRA, the full application can be downloaded on our website. We will assist you with completing the packet, because again, there's a lot of questions and a lot of documentation that has to be gathered. So our team will assist you in putting that together. You can call us again at that 1-800 number, or contact us via email. We will help you put it together so that you can then mail, fax, or hand deliver it to HHS for submission. TEFRA eligibility determination can take several months because it's really a two-step process. So HHS, Medicaid, is checking those financial income requirements, making sure all of that checks out. And then once that happens, the disability packet, which again is a lot of that medical records, making sure they fit within that determination, will go to South Carolina Vocational Rehab. And that's when Voc Rehab is going to look at those listing of impairments. That SSI category I mentioned earlier, there are certain requirements or listing of impairments, as it's called, where a child would be deemed eligible based on their diagnosis. So they're going to take a look at that, make sure that that child is eligible, and if needed, bring in other individuals or request additional documentation from the family, just to make sure they're reviewing all available resources before making that final determination. Again, as they're looking at the disability determination, they're also looking at making sure that that child meets a level of care outlined in TEFRA, and you'll see those listed here. So once they meet a level of care, or all of those other phases have been reviewed, then Medicaid is going to make that eligibility determination. And you can see why it may take several months, because it is a multi-step process. But the good news is, once that application is submitted, and if a family is deemed eligible, there is a retroactive period, 90 days from that submission, to cover those medical costs if needed. If a family is denied, there is an appeal process that families can follow to appeal the decision. And, oftentimes it may be something as, like some submission of some additional documentation, medical records, things like that, to get the child covered. So let me pause for just a second and take a look at the So Vicki, your question about ASD. So they can stay on ASD, age blind and disabled. I think, oh, I'm sorry. You may be saying autism spectrum disorder. They could fall in the category of Tephra, yes. That may be something you want to look into applying, and I would suggest contacting our office. There's a certain other levels of factors that they're going to look at based on that diagnosis. So definitely, I would suggest reaching out to us and having us kind of talk through what medical records you currently have from the adoption process, and then we can determine what might be the best route for y'all applying. Naomi. Okay, so yes, Naomi, your preemie will stay on their Tephra will cover them up to 19. So again, when they get into about the 17, 18 age of transition is what we call it, that 17, 18 age range, looking at what might be some other coverage options for your child, and that may be age blind and disabled or another category of Medicaid that they would fit into that would still allow them to keep their coverage and allow them to get the services that they need. But yes, since she's on it, or he or she is on it now, they will keep that until they age out. And HHS, and we'll talk a little bit about this too, will notify families as it gets closer to either the review period or the time in which they're going to be aging off. So that may be something to think about as they get a little bit older. And yes, Vicki, so definitely I would encourage you to reach out to our team and we can talk through what those options might look like for you. If they're both on Medicaid, getting them in for Tephra may give you some additional supports, and we'll talk about what that means in terms of being on fee-for-service or having a managed care organization that works with you and your family. So real quickly, managed care organizations are entities that help manage care. So they're insurance organizations. You may be familiar with Absolute or through Blue Cross Blue Shield, but they are those individuals who are enrolled in an MCO are going to receive the HHS Medicaid card, and then we'll also get a card for their MCO, and we'll receive any other additional benefits that MCO might offer. You'll see them listed here: Absolute Total Care, First Choice, Healthy Blue, Humana, Molina. So you'll get the same benefits, but again, there may be some other special membership benefits available depending on which MCO that you have. Certain categories of Medicaid members are required to choose an MCO. So you'll see those listed here, some that we've already talked about today, like Partners for Healthy Children or age blind and disabled. Other categories are not required. It is optional, Tephra being one of them. So, if your child's already receiving Medicaid services, maybe through fee-for-service, regular Medicaid, or through an MCO, they could still keep that and apply for Tephra for any additional services needed. So you'll see some categories are not required to choose at all. And then other categories must remain fee-for-service, or what we call regular Medicaid. And those are typically most common are families that are using a waiver. And we can touch briefly on that too. Any questions? Yes, so families have an option. If it's optional, they may decide it's better to choose an MCO or not, but they do have that flexibility. Again, fee-for-service is just going to be that regular Medicaid, and there's no sort of overarching organization that's going to kind of manage or gatekeep those services. All right, I know we had a question earlier about mode of care, so I want to make sure we get to that. Thanks so much for your questions, by the way. Keep them coming. They're great. So mode of care is transportation services available through Medicaid recipients. These are non-emergency things like doctor's visits. And there is information on, based on region where you live in the state. You can contact that region and let them know that you are either requesting a service for a transportation, or that you yourself are going to be transporting your child and then are eligible for that mileage reimbursement. Again, it's going to have to be in the state of South Carolina. Out-of-state services are not covered, and it's going to have to be, again, for those non-emergency services. So the mymotivecare.com has a South Carolina page. You can see it listed here on the screen. You can go there and find out which region you're in. Contact them. If for some reason you need the form, the mileage form, or you have other questions about what needs to be filled out, you can contact them and request that information. Or if you need to contact them in preparation for an upcoming doctor's appointment, let them know, request that trip number so it can be logged. You can track your mileage, have the provider sign off on it, and then turn that in for your reimbursement. So again, if you have questions sort of navigating Motive Care or aren't sure, you can contact us and we can certainly get you in contact with the folks over there so that you can get that reimbursement. Erica, I saw your question about, so thank you so much for bringing that question up about being eligible for Medicaid and has SSI. So the thing about SSI and TEFRA is you can only have one or the other. So if a family decides that they no longer want TEFRA, but they want to apply for SSI, they can certainly do that, or vice versa. For a lot of families moving from out of state, TEFRA is not an option in their state. So they may have secured SSI when their child was really young, moved to the state and realized, we can't have TEFRA without letting go of our SSI. Certainly that's an option for the family, but in most cases, the benefits that they're getting from SSI suit their needs at that time. So it's one or the other. Families oftentimes, may not know that or may not be aware of it, especially if they're coming from outside of the state where TEFRA wasn't an option. It is only available in a handful of states, but it is one or the other. So we certainly work with families all the time, just helping them weigh their options about what might be right for their family, either at this moment or as their child gets older, what services and supports they might be looking for so that they can apply for the service that best meets their needs. Again, like I said, at this point or as their child ages. And
so they might be able to have SSI and Medicaid based on income, but just
right.
not TEFRA. So
yep.
They would have to choose an MCO.
Right.
Okay.
Yeah, thank you for that question. And some of it is very nuanced, just depending on the family or depending on the situation. And so that's why our healthcare team is here just to kind of work through some of those questions. Yeah, thanks for your question. Let me go back just a second. Oop. We are coming to about halfway point. I wanted to briefly mention health insurance premium payment, HIP, which is available and eligible for Medicaid families who retain their private health insurance. And they're, again, are enrolled in fee-for-service, and it can help families who, are looking at have children with special healthcare needs, and just helps them to maintain their existing health insurance, but may allow them to qualify for monthly reimbursements through that health insurance premium. There is a really great frequently asked questions document that HHS puts out about HIP. We can certainly share that with anyone who is interested, if you're interested in learning more about it. But just know that is an option for families who do retain their private health insurance. And the last thing that we're going to talk about today, before I turn it over to Aisha to talk about Medicaid annual enrollments, are waivers. So there are a category of waivers available for individuals to receive special services And again, these are for individuals or families who are in the community setting, trying to avoid any type of placement. The waivers are administered by HHS, and then some are operated by DDSN, so it's our Department of Disabilities and Special Needs. And waivers must be used at least once. So those services must be used at least once every 30 days to to maintain their eligibility. And you'll see this is something that, and again, can be shared with you all after the presentation. This waiver summary chart is a great sort of quick snapshot of what each of the waivers are. Many of you all may be already familiar with them, or you may be looking at what waivers might best suit the needs of your child, of your family. You can see a little bit more about who's eligible. For instance, you'll see the first table, or the first column on this table, talks about community choices waiver. It's available for children or for individuals who have physical disabilities 18 to 64 who meet that level of care, that nursing level of care facility eligibility. And you can see towards the bottom of the screen where it talks about what those available services are, including, personal care, respite care, adult day health, things like that. So depending on your child, your young adult, looking at what some of these waiver options might be best for you all can help provide some additional services and supports outside of the Medicaid that your family may already be receiving. Just to keep in mind, and again, the waiver presentation is a much longer presentation that we do, and we can walk through those options with you, or again, you can call our office and we can kind of explain those in a little bit more detail. But the one thing that's important for families to keep in mind is there are wait lists for the waivers. There's varying lengths, and so it may take a while, months, years, for a family, for a child to come up for their turn on that particular waiver. But even though you can only receive services for one waiver at a time, you can be on multiple wait lists. So depending on the age of the child, their needs, level of care that they're looking for, services, there may be multiple waivers that a family decides we want to be on a wait list for, and just make a determination when that spot opens up, if that's the waiver that they're going to go with. And again, all of that are things that we frequently talk through with families. It's a big decision to make, and sort of forecasting or thinking ahead about what might be the best need for that child, for that individual, and trying to match that with the current waivers that are available. So with that being said, I'm going to check the chat real quick. Just as a reminder, you can call us. That 1-800 number is on your screen. That 1-800-578-8750. You can also contact us through our website, familyconnectionsc.org. We have a button at the top that says referral. Families can put in their contact information and request us to reach out to them related to a question about Medicaid, about waivers, or about, again, any of our other services that we provide. So I'm going to pause for just a second, check the chat, and then turn it over to Aisha. I see, yes, Vicki. Okay, yeah. So if you applied last year, there may be a waiting time, depending on, Tephra or the waivers. Tephra can be several months. Certainly the waivers are typically a little bit longer. And I think your question about requesting reimbursement was 90 days from the date that your Tephra application is submitted. But if there are other questions, y'all can keep putting them in the chat. While Aisha gets her presentation set up, I'm going to drop that 1-800 number in, our website in, and then my contact information in, if anybody else has questions following today's presentation. So thank y'all so much for being on. And Aisha, I will turn it over to you.
All right, thank you. Let me change and make sure you all can see my screen. All right, are you able to see my screen? Not yet? Oh, because I gotta press share. Now can you see it? Okay, perfect. Good afternoon, everyone. My name is Aisha Coney, and I am a training supervisor, with the Department of Health and Human Services. So I'm going to just do a brief overview of our annual review process that is coming out. Here we go. All right, so our goals of the agency is we want to make sure that we promote continuity of coverage for eligible individuals. And we have hired additional workforce so that we can ensure that we have a balanced workload amongst our caseworkers. So this will help us to not create a backlog, and we will make sure that we can limit delays in the redetermination process. So we want to ensure people who are eligible for Medicaid, they can remain getting covered with Medicaid. So here are some key dates and activities. The first date is December 29th, 2022. On that day, the Consolidated Appropriations Act was signed, and that allowed South Carolina to resume the annual case review process. On February 15th, the review distribution plan was created. And then we have March 31st, continuous enrollment requirement will expire. On April 1st, that is an important day, that is when the standard annual eligibility reviews will resume. So we've stopped them because of the public health emergency due to PHE, but beginning April 1st, 2023, the standard annual eligibility reviews will resume. On April 8th, we have to report to CMS. And then on May 11th, that is when the actual public health emergency will end. So the federal public health emergency, PHE, ends on May 11th. So for our review process, so in March, the agency is going to send out, so they've already began sending out pre-review notices for people who are scheduled for the redetermination in April. So if they were scheduled, we have a rollout plan. So those who are scheduled, they will receive that pre-review notice approximately 30 days prior to their redetermination. On April 1st, the first review will be initiated. Also, the first week of April, we'll have the continuation of benefits notices and annual review forms mailed out. We'll also send text messages to those people who have put their phone number on there as well. The first week of May, the first disenrollment notification will begin, and we'll get closure notices to our beneficiaries. June 1st, first closures for failure to return the review form. So the client does have time, they have to return that review form to us. Each month, we will do a monthly electronic data will be used so we can see if that person is going to continue to remain eligible for coverage. We'll also send out review forms. So the review forms will be sent out about 60 days prior to their review, prior to that redetermination date. And then we will also, anybody who does not return their review, within 30 days, they will receive a letter of closure that their Medicaid coverage will end.
Question, so this is for all Medicaid and TEFRA recipients.
Right now, this is our rollout right now, what we're looking at, and I believe I'll talk about this on the next slide. Right now, it's going to just be for our people who've aged out. So people who were once PHC, that ends at the age of 19, they're no longer eligible. Or someone who was getting former foster care, they've aged out at 26, they're no longer eligible. So that's who we're focusing on first. That's our first group. Any other questions? No, okay. All right, so our review distribution, again, is going to be distributed across a 12-month period. So states have 12 months to initiate that redetermination and 14 months to complete the work. Again, the distribution will begin with groups likely no longer eligible. So you may see somebody who was pregnant when they got on coverage and we kept them on coverage. They may be somebody who was no longer eligible. They no longer meet a coverage category. They're no longer categorically eligible. So they will be in that first distribution group that we will be doing the redeterminations for. We will be ex parte, so just moving someone into coverage if they are eligible still. And the remainder of the redeterminations will be distributed across the 12 months. So then we may get into people who are no longer eligible based off Tephra and things of that nature. But right now we're just focusing on people who've aged out or they're no longer pregnant. They no longer meet that categorical criteria that put them on Medicaid in the first place. All right, so we have several different ways that we've been communicating this. So we have our website, we have newsletters that have been going out to the public, press releases, we've been on the news, even on the radio, different web articles, social media. So there's several different ways that you all are able to, that the public is able to hear about our review, our redetermination process. So presentation like I'm doing right now. So that's another way that we're doing our outreach. We do have an email, annual reviews at scdhhs.gov. We also have a change of address and contact information. So this is very important for people who have moved. They're worried about getting that review. They can go to that website and they can complete the form. It's a change of address and updated contact information. Even if they have a different phone number, they can complete that information. They can also contact our member call center, which is 888-549-0820. That's Monday through Friday from 8 a.m. to 6 p.m. They'll also can receive text messaging, the annual review pre-mailings, which are being sent out now, which is also going to be helpful to just notify someone, hey, your review is about to be expired and about to come up. So we do have that. And this is just reiterating what I just said with that change. So if you have any questions or need to report an address change, it is very important that you do it online with the apply.scdhhs.gov. You can change your address also by using our phone number, the 888-549-0820. That lets you also check for your eligibility. And just if you have any questions or any changes you need to make, that's your best way to contact us. You can also visit your local county office, where a lot of our offices are co-located with DSS. So if you go into a DSS within your county, you'll be able to speak to somebody with Department of Health and Human Services to get the correct address and everything for Medicaid. And then also your providers. If it's a provider here, then you would want to contact that member contact number or through the email with the annual reviews at scdhhs.gov. All right, and I have a question.
But notices of review will still go out to everyone to fill out and return.
Say it one more time.
But notices of review will still go out to everyone to fill out and return.
Yes, if you are up for your annual review, you will receive that review 60 days prior to the end of the coverage, and then you'll have to make sure you complete that and turn that back into us. Okay, got another question?
Any chance we can have access to this PowerPoint? I would love to put some of this info in our parent newsletter.
Let me get back to you on that. I need to reach out to communications and find out. William is taking notes for me. So William, will you write down whom that is, who asked for that? And then if we're able to share this PowerPoint, then I'd be glad to. Any other questions for me? And yes, I do believe I can share this. So yes, I'll just get this back. So, yep. Any other questions? All right, thank you for your time.
Thanks, Aisha. Appreciate it.
You're
And yeah,
welcome.
I see Erica's information in the chat. Okay, great. So we can get that
Perfect.
over to you, and we can also share it with the rest of the folks on the call too.
Great.
We can share that along with the waiver information and also the MCO
So
overview. as well.
can you verify just one more time? All they have to do is return that form. If they return that form, then their coverage should continue, correct?
If they're eligible, so they
If
still
they're
have to meet
eligible,
the
right, if
criteria,
they're
but yes.
Yes. And part of the problem might be if their address changed and they never communicated that to Medicaid, they won't get the form to know they need to review, and they could be dropped potentially.
Correct. And I'm sure once they'll get that letter saying that they're no longer eligible. So it is very important that they do make sure that they provide that information to us so we can keep their coverage going if they're eligible. Yes.
Okay, super. Thank you.
You're welcome.
Thanks. Yes, we know that it's sort of it's a lot happening at once, and like
Mhm.
y'all said, you're trying to work through through families at a time, groups at a time, to sort of get everybody taken care of. But the most important step at this point is making sure information's updated, and then when you receive that form, to complete it and return it.
Yep. And even if you just call, if you're not sure, a lot of people have been doing that as well, just calling and making sure they have the correct address, the correct phone number, because again, we are doing text messages as well. So whatever, if you're not sure, if your beneficiary is not sure, make sure that they do contact us, either whether it be email or over the phone.
Great. Thank you so much. That's
You're
really
welcome. Thank
helpful.
you. Great.
Oh, and Vicki, you have a question about the waivers. Do you have to have the waiver to get on Tephra? No, you do not. Many families just have Tephra as a supplement for their services that they need and don't have waivers, or they may end up having waivers at a later time. So that's certainly an option for families, just depending on what their needs are. Before we wrap up today, again, if you have any other questions, feel free to drop them in the chat. I am putting our training calendar in the chat. So we have several upcoming trainings just like this. We cover a lot of content, not just related to Medicaid. We also cover a lot around education and transition age youth, just making sure they're ready for those healthcare or those ed-related transition ages. We also do a lot around early education and parent support. So you can visit our online training calendar to see what we have coming up for the rest of the month or even into April. And then the other thing that I would mention too is our annual conference, which is Hopes and Dreams. This year it is going to be held in person May 3rd at Richland One Conference Center. The save the date is out. The registration information will be coming out soon with speakers and schedules. There are scholarships available for parents and caregivers, so you can stay tuned to look out for that. If you have any other questions, you can again contact us at the information that we provided, or visit our website or call us at the 1-800 number. Lots of ways to get in touch with us. But we want to thank you all so much for being on today. You should receive a survey after the presentation concludes. We would love your feedback. It just helps us make sure that the information we're providing is helpful and useful to our families and to our providers. And if there's anything else that any other resources or supports that you're looking for, you can reach out to us. Thank you all so much for being on, and hope you have a great rest of the day and week. Bye, everyone.
Thank you.
Thanks, Aisha. Bye-bye.
Bye-bye.